Have you been troubled with lower back pain for quite some time and it's stopping you doing the things you enjoy doing? Maybe you've been told to listen to your body. Well, my name's Anthony Gosh, I'm a consultant spinal neurosurgeon, and in this video I'm going to debunk some of the myths around back pain and explain the things you can do to help. I often hear the phrase non-specific lower back pain being thrown around a lot. That doesn't exist in my practice. When this phrase is thrown around, what clinicians often mean is that there are no signs and symptoms of, say, nerve entrapment, for example, or no findings on your scan that you can identify as the cause of the back pain. Therefore, I prefer the phrase non-pathological, meaning for me as a surgeon, there isn't an area that I can specifically target with anything invasive like an operation or an injection to say, this is the cause and this is the intervention I can do. But that doesn't mean there isn't a cause or a treatment strategy that we can work with. Maybe you've had an MRI scan or an X-ray and words like spondylosis or bulging discs have been mentioned. These are not necessarily causes of back pain. They only give me concern as a surgeon if these bulging discs are pinching nerves and sending pain, weakness or numbness down your legs. Otherwise, they are very common findings in people who have never even experienced back pain. If I've clinically excluded pain radiating down the leg, sciatica, from a trapped nerve, and your scans have excluded any other pathology that puts your spinal cord or nerves at risk, such as a slipped disc mentioned earlier or a fracture, then the evidence suggests that moving around, doing some of the things you enjoy, such as exercise, walking, doesn't actually cause any harm, and any pain you're experiencing during these activities does not correlate with any harm you might be causing. I want to illustrate what I mean when I say I don't believe in the diagnosis non-specific back pain. So at the onset of the pain, there's always a cause. It may not be anything serious, but it's often something like strain in the muscle, or maybe some inflammation of one of the joints of the spine, some strain of one of the ligaments. So let's call that the pathology, the original pathological cause. And think of pain as a jigsaw puzzle where all these different pieces make up the pain. At the onset, the pathology itself, the tear in the muscle, makes up most of the pieces of the jigsaw puzzle. As things heal, and based on abnormal beliefs that we've adopted from poorly laid out information online, we start to adopt what are called false protective behaviours. And then things like anxiety, fear, stress are also very potent amplifiers of that pain. And after a while, the pathology is just a very small part of the cause of that pain. There is extensive research carried out on this by Peter O'Sullivan, who I interviewed on my YouTube channel. You can check out the link below. And he has proven that if your pain is non-pathological, then learning to trust your spine again and moving around is beneficial in the long term and does help massively. Sometimes it's quite difficult to do that with all the pain you're in. So painkillers, they're not so much there to mask the pain, but they give you a break in that pain cycle. And once you get moving again and get blood flowing into your spine, then after a while you can back off on the painkillers and things will improve with time. Sometimes on your scan, I can identify an area that may be the source of the back pain, but not necessarily a pathology that requires surgical input. But having that is quite useful for directing the physiotherapists I work with on the source of your pain, and therefore a strategy of specific exercises or stretches or even injections that I can apply to help with that. I really hope you found this video helpful. If so, please click like and subscribe to the channel, and please visit us at spinemdt.com to see how we can help you. Thank you for watching.